We are all so busy these days, and we're always looking for helpful tips and advice on how to find a better work-life balance. We all have to earn a living and pay the bills, but are you doing enough to look after yourself and your health at the same time? Now, many of us prioritise careers and work, and we're slaving over our computers and mobiles all the time. But does this make you cut corners on your diet, exercise or sleep? I'm Dr. Ben Sinclair, and welcome to Health versus Wealth with Dr. Ben. Our guests share their life experiences and we discuss their challenges in their health and their wealth. I hope their experiences will help you with your life and health. Now, I'm joined today by Dr. Neera Jaitly and her son Jay, who's 13. And today we're talking about long COVID in children, which is a subject really close to my heart because there are over 70,000 children suffering from long COVID in the UK. And Jay is one of my patients and Neera is his mum, and Jay's had long COVID for 2 years. So guys, thank you so much for coming to the show. Really nice to meet you today. And Neera, you're a GP.
I am.
But I hear at work you have another nickname.
Yeah.
Not Dr. Jaitly. What is it?
Some of my receptionists call me Dr. Doolittle because I have a house full at home with many animals.
So you've got a menagerie.
I have.
Give us the full list. What have you got?
So we have
home?
2 pugs.
Okay.
A sheepoo.
Anything else?
A tortoise.
Okay.
A budgie.
Okay.
A gecko.
No.
A hamster.
Okay.
Is that it?
Yeah. Anything else?
That's it. Is it?
Yeah. What about, I know Jay does like
the
playing
chickens.
the chickens, right? Okay, you forgot the chickens, Dr. Doolittle.
Yeah.
Wow. So you've actually got quite a few people at home. Who else is at home?
So we've got my daughter who's 14, 18 months older than Jay.
Yeah.
My husband and my mum who has Alzheimer's. She's 87. So.
Wow. And so you're part of this sort of squeeze generation.
Yeah.
Where,
the sandwich generation.
Exactly.
Yeah.
And we're looking after older people and younger people and trying to hold down a job.
Yeah.
And you're a busy full-time GP.
It gets very busy.
Now, what's your practice called so we can name check the wonderful people there?
Farley Medical Practice.
Farley Medical Practice
in Selsdon.
In Selsdon.
In Surrey, yeah.
Fantastic.
Yeah.
So a big shout out to all the staff there.
Brilliant staff there.
Lovely. And they're doing a great job looking after people.
Yeah.
In what's really challenging circumstances.
Yeah.
Now, tell us more about you becoming a doctor.
Okay. So I've always wanted to be a doctor. I don't know where it came from. There was no one in the family who was a doctor before me. But I worked in a nursing home from the age of 16 all the way through my first degree and second degree and loved it. And then I always thought I'd be a paediatrician, a children's doctor. So I went into paediatrics, loved it, but I missed adult medicine.
Yeah.
And also when I was at Leicester University, one of my colleagues who I'd worked really closely with and been a medical student with, they died in a car accident just before, just after the house officer year actually. And that changed my mind. I thought I want to change general practice because at his funeral, people were asking what music he liked, what films he liked. They didn't know anything about him because he'd been in hospital all that first year. And actually it made me think about what I wanted to do with my life. And I wanted to be able to go to weddings and be there for Christmas and have children and be able to pick them up, just be there for the family and friends.
Yeah, wow. Yeah. So strong emphasis on family, I'm hearing.
Yeah.
And we're talking long COVID as the special interest subject today.
Yeah.
Do you have any patients with long COVID?
Yeah, I've had quite a few adult patients with long COVID and I was able to refer them onto the long COVID clinic in our area. So I've treated quite a few.
And what were the challenges for children with long COVID?
So with children, it's difficult because not many people know about it. And actually, when Jay was first unwell, I myself didn't realise it was long COVID. I was going through so many different causes for his symptoms, couldn't find any answers. I actually went on a doctor's group to talk about his symptoms and they suggested to me it could be long COVID. And that's when I looked into it a bit more.
Did any of your training prepare you for this unusual condition?
A little bit. So when he was quite unwell, it did mirror ME or chronic fatigue syndrome. I could see he was mostly asleep. And so obviously I've treated patients with that. But I did know that certainly it was a completely different child that I had. I could tell he was suffering just because it was a big change from who he was. He was usually quite an active child.
Right.
I'd be watching TV, he'd be throwing balls around, I'd be telling him to be quiet, he was running up and down the stairs.
Typical teenager. Yeah.
Typical.
Yeah.
So it was such a shock for him to just be lying on a sofa, not moving, not doing anything.
Unusual.
Yeah.
Now, Jay, if I can speak to you a bit more, obviously, I'd love to find out more about how you're doing now. The listeners can't see, but you're actually in a wheelchair in the studio today.
Yeah.
How's long COVID affecting you right now?
So I'm in a wheelchair and I can't do the things that I want to do. So I can't play football, can't do boxing, and it's really annoying. And I also have tuition 3 days a week for 30 minutes. But sometimes I can't do it because I have crashes. So when I do something like go to appointments, I have to rest days after. Otherwise, I'll have a big crash and then won't be able to do anything.
Wow. So quite a big impact from what your mum was telling us about previously very active lifestyle.
Yeah.
Just tell me about, you've mentioned the word crash. For people who don't have long COVID, what happens to you when you crash, if you can tell us?
So when I crash, my arms and legs are really weak.
Okay.
So I can't pick up anything. So I can't really pick up my phone. I can't go upstairs. So
So it's a real difficulty to move, yeah?
Yeah.
And how long does it take to recover from a crash?
So sometimes it's better than others. So it could take like maybe a day, but sometimes it can take a week or two.
Wow. So it's a massive impact on your normal
Yeah.
life. And you're on a journey. You've had this for 2 years.
Yeah.
Tell us a bit about your journey and your motivation for coming here today, which I'm sure we're really grateful for because so many people are going to know more about this as a result of you coming. Tell us a bit more about your journey.
So I got first on COVID in 2022, and I got COVID and I didn't have any really bad symptoms. All I had was I was a bit more tired and just had a runny nose, but that was it. And then like maybe a few weeks after, I got really bad abdominal pains.
Yeah.
And we went to A&E and they couldn't really find anything that was causing it.
Okay.
So we went to a doctor and he did like a blood test, but there was nothing really on it.
So the blood test was normal.
Yeah.
Okay. And can I ask, Mum, I mean, as a doctor watching this process, how was that?
It was very difficult. So for a doctor to take their child to A&E, it must be bad.
It's got to be serious, right? Because we try and protect the NHS,
we
don't we?
We do. We only go when we can't solve something ourselves. But actually the pain was waking him up at night and he was in a little ball. So obviously I was worried something was going on. He was crying with the pain. It was so intense. He had night sweats. His fingers were peeling. I could tell something was going on. So we actually went to A&E about 3 or 4 times with the same problem because there was a change of bowel habit as well. So I felt there was something.
You were concerned?
Yeah, really concerned. This wasn't my child. He was quite unwell. He wasn't eating or drinking anything. It was worrying.
And I mean, for adults, we've got these long COVID clinics.
Yeah.
But when this was kicking off,
Yeah.
as far as I know, there were no long COVID clinics for kids in the UK.
No, there weren't.
Now, you saw some specialists. How did that go?
So at first I asked the GP for a gastroenterology referral, a paediatric one for Jay, because all his symptoms were gastric. But the wait was going to be about 6 months.
Okay.
So I ended up going to see a doctor privately who did an ultrasound, did an endoscopy to look down into Jay's stomach.
So camera down the throat into the tummy.
And also diagnosed Jay with post-COVID inflammation of his bowel and chronic fatigue.
Okay,
going
so
through
lots
his
of
symptoms.
diagnoses.
Yeah, a lot of diagnoses, which helped that he'd been seen. And he also put Jay on bowel rest for a month where he didn't eat anything. He only had 40 juices and 46 build-up drinks for a whole month. to let his bowel rest and repair.
To try and just let it all recover.
Yeah.
Wow, that must have been quite challenging, just drinking.
Yeah.
Yeah.
And at the time, Jay was still trying to go to school. He was in year 6, so he'd go in with his 40 juices and he'd go to the office at lunchtime and drink those there. So, children didn't see him in the dinner hall, but he managed to go in and finish his SATs exams in year 6. And sometimes they'd call me and say, pick him up, he's got tummy pain. So it was a very difficult time for him then because he was still trying to lead a normal life.
But you kept going. That's so impressive.
Yeah.
And unfortunately, in long COVID, we all try to keep going.
Yeah.
And then eventually we kind of have a big crash, don't we? And is that what happened?
Luckily, it was the summer holidays. So in the summer holidays, he could just rest.
Okay.
So we let him sleep. There was no schoolwork to do. And so he actually got better. And that's when I learned about pacing. So I'd learned about pacing through my reading.
Yeah.
Where I learned that Jay has a specific energy envelope and he can't go over his energy use. And I have to be guided by Jay.
Yeah.
It's only he knows how much energy he has. And actually, he did get better. So towards the end of the summer holidays, he could go back to boxing. So he went back to boxing. He started high school. He did a whole term, made new friends, was playing football. It's like we had Jay back. It was amazing.
Things went well.
Really well. Yeah.
And you mentioned that you were seeing a specialist rheumatologist at that time?
So, no, that was after. So in January 2023, my husband had just had COVID. We tried to keep him away from Jay, but then Jay suddenly had a temperature of 40 degrees and a very sore throat. At that time, there was a lot of strep throat going around.
I remember there was a big outbreak, wasn't there?
And so doctors weren't actually seeing children. They were prescribing antibiotics over the phone.
Okay.
That's what happened with Jay. But we wonder whether it could have been COVID, but there was no testing at that point for him.
Yeah.
After that, it was a week after that, suddenly Jay lost mobility.
So it sounds related, doesn't it, to that infection?
Yeah, a huge shock. So again, we went to A&E and they couldn't find a problem, could they? Just slightly raised inflammatory markers showing there was some inflammation going on. But it got worse, so worse that actually he was crawling to the toilet. I was having to lift him onto the toilet. He was so weak. I was having to lift him into the bath. He was trying to use the door frame to lift himself up. And it was quite a scary time, actually, when he lost his mobility for both of us.
That is scary, isn't it? I mean, especially when you had been so active, you're boxing and playing football, and then suddenly, bang, your legs stop working. So did you get any advice? Did anyone tell you what was going on at that point?
No. So I spoke to the GP and asked for a rapid access appointment. So we were seen by a paediatrician in the clinic there. And he said, I think it's your long COVID. I'll do one test, but after that, I'm just going to discharge you. So it was very...
Wow. Why were they discharging you when you couldn't walk?
Exactly. It was quite scary. And we were both astounded, really, weren't we? It seemed like they just didn't want to know about it. They read long COVID and that was it. They were very dismissive of the change in symptoms. Yeah.
Jay, how did it feel with your legs when you couldn't use them?
So it felt like there was an elephant sitting on my legs and I could barely stand and move them. And when I used, I had a walker.
Okay.
So when I tried to use the walker, I didn't know where to place my feet and it was kind of like a stroke.
Did you know where your feet were or could you not really feel them? Yeah, it's hard, isn't it? I had the same thing when I had this. My left leg went completely, and I kept on tripping over my left foot. And it was dragging on the floor, and I didn't know why.
No.
And no one could tell me why.
No. And even watching him, it did feel like he had no coordination. He just didn't know how to control his legs or feet.
And, sometimes when we go to the doctors with these symptoms as long COVID patients, they don't believe us because they don't know what's going on. What happened to you?
So we went to see a rheumatologist because some of his blood test results showed some inflammation.
So there were some changes on the
there
blood
were
test.
some changes. So I was worried there was something we weren't picking up.
Yeah.
So we actually went to see a rheumatologist, and Jay was telling him about his legs, and it felt like there was an elephant on them. He couldn't control them. And he was actually, again, quite dismissive, saying that, I think Jay's scared of walking. And so I did say, what child wakes up one day when they're previously so active, thinking, actually, I'm going to crawl around the house now, I'm scared of walking. And I said, there's nearly 70,000 children just like him with all similar symptoms. Did they all wake up one day scared of walking? It was awful, gaslighting. And actually, because he's a child, he felt completely unheard.
Absolutely.
And just shut down. He didn't want to say anymore because he didn't trust this doctor.
Absolutely. I'm not surprised.
Yeah.
And if someone tells you they don't believe what you're telling them, you're not going to trust them.
No.
Are you?
No.
And sadly, there's 2.3 million adults, and there's over 70,000 children with long COVID, all having this strange symptoms, which and I had weird symptoms as well, and no one believed us, which is bizarre, isn't it? You can't have an entire population of I don't know. 2.5 million people wake up one day and decide to fake an illness. Yes, some people do swing the lead, if they don't want to go to work. But actually, most children, they want to get out of bed.
Exactly.
I bet you wanted to go boxing, play football, but you were being gaslit and actually not believed, and that's so destructive.
Yeah, so difficult.
Can I ask you, Neera, as a GP now, going through this process, has it changed how you talk to patients and believe them?
So I've always believed my patients. I've got a really good relationship. I've been at my practice now for 18 years. I know my patients really, really well, but I've always listened to everything they say. But I know that a lot of patients don't feel heard when they go to hospitals, and it's so important to hear things from their point of view and understand how it's affecting their life. It's so important.
Exactly.
Yeah.
I totally agree with you. When I used to work in prison, there was a handful of people who would try and fake things to get things. But the majority of people come to a doctor for help.
Yeah.
And why I set up Dr Finley's was to try and help people, but to have more time and the right resources. And that's how we met, because I ended up finding that people with long COVID were coming to me, adults, and actually, because there's a genetic bit of this, they were saying, actually, I've got a daughter with this as well. Can you see my daughter? And I said, well, I'm a GP, but I'm willing to find out more about this. And there was a great charity that we both sort of have been connected through.
The Long COVID Kids Charity is amazing, and actually that's where I got most of my help throughout this 2 hours with Jay. So I found that there were children similar to him. I found education material for the school. I found information about pacing, and actually it's where I found Long COVID Clinic. So, it's such a supportive place because they've all been through the same journey as you, and the children have all been through the same journey. So,
Now, Jay, in front of me, we've got this fantastic piece of artwork that you created. Can you tell us a little bit about this sculpture that you brought in today? This
is called My Disrupted Life, and I wanted to make it to show, because my friends didn't really know what was happening to me. They just thought I just wasn't at school anymore. So I wanted to show them what it was like. So I made this COVID sculpture at the top of the jar. Okay. And
got a brilliant sort of little image of the COVID virus there. I love that. And what else is on the jar? So it's a sort of a sweetie jar. So, talk us through what else is on it.
So inside the jar is pictures of me now when I have long COVID, and it says all of the little words of like what I have. So for example, there's fatigue, exhausted, physio, blood thinners, appointments, bedbound. It shows me going to hospital and not being able to walk and sleeping a lot. And on the outside, it shows that I was what I was doing before. So I could surf, I could box, I could fish, I could play football, and I can't do those things anymore.
Now, the reason why I'm talking to you and working with you is a hope that we believe, we'll be able to find things to get you better. And one of those things is therapeutic activities. Tell me about what you do with the chickens.
So I cuddle the chickens, and I love feeding them, and I love playing with them. Also my dogs, so I love cuddling my dogs as well, and they always come and sit with me on the sofa when I lie down. So yeah.
Amazing. And Neera, you must be so proud of Jay's artwork. Where has it appeared?
So this appeared in the Royal College of Arts in London, in the Young Artist Summer Show in their exhibition. So it was chosen out of hundreds of artworks. So we were really proud, and they displayed it in the Royal College.
It's really lovely to see what you created. I think it just goes to illustrate the difference, because what I notice with kids is they just disappear. And so schools often think of it as truancy. And so the person you get most contact with at first from a school is the attendance officer.
Yeah.
And they're going, why isn't he at school? What are you doing? Are you, being a bad parent? Yeah. And so many young people are going, I'm desperate to go to school, but I just can't even leave the couch or the bed, or when I do, it's too overwhelming. So it's a real problem, and I think we're actually developing courses at Dr Finley's to educate schools about how to help. We've already done a pilot course for one school just to say this is how it might actually help some of the students. And what's good is when the schools are aware and understanding, then they go, oh, of course. Yeah. But if they don't know, then it feels like they're punishing you. Yeah. It's good to hear you've got some home education happening at the moment. How does that work?
So the home education is from school. I have little bits of homework. So I have maths quizzes, little science quizzes. So I do them every week. And 3 days a week I have English. So that's the tuition. Okay, so actually, does that like online or face to face? Yeah, online. Online tuition. We go on Google Classroom, and then he sets work, and then he just teaches me about it. But if I'm too tired, then he ends it, and then a bit later I can do the work and then submit it. It can online. Catch up again.
That's good. And with this kind of way of learning, sometimes people with long COVID get what's called brain fog. Yeah. Do you get brain fog, Jane? Yeah. How does that affect you?
So it's hard to like receive what people are saying. So it's hard to know what they're saying and then answer questions what they're telling you.
And actually, I think you're doing really well today, because I'm asking you questions and you're coming up with some great information here. So well done. Now, so what we see in long COVID is that the brain is struggling to process stuff. So someone might talk to you, but you don't actually know what they're saying. You just see their lips moving and you hear stuff and you're like, I don't really know what they're saying. And they have to repeat it. Yeah. And it can be very strange to be that person. I was also that person. And my wife got so annoyed with me because I never understood what she was saying. And then we finally realised it was actually brain fog. And we now know that it's probably to do with the problems with the nerves functioning in the brain, probably because of lack of oxygen, maybe because of people with long COVID get little blood clots in their bloodstream which slow down the oxygen. So it's like being at the top of Everest but not having oxygen. And if you know anything about mountain sickness, it's that people get confused, they get forgetful, they do funny things, they lose coordination. So a lot of these things may be related, and we're beginning to learn more about that. It sounds like you've had fairly typical symptoms, but quite extreme symptoms in the legs. And but it's amazing to hear that you're finding ways around it.
Excellent. He described it as feeling as if his Wi-Fi kept disconnecting, which is a really good way of describing it.
That's a really good way to explain it, because it's really hard to explain these things to someone who doesn't sense them. Yeah. Brilliant. That's really helpful. Are there any, I know sometimes people react to different foods. Have you ever had problems with different foods?
No.
You've been okay with that?
Yeah.
That's reassuring. And what about sleep? Has your sleep been okay, or was that affected?
So I could sleep for So go to bed at say like 10 and wake up at like 3 to 4 and I'd still be tired. So I'm tired all the time, every day, and always want to have a nap.
So we call that unrefreshing sleep. So even though you might sleep, you still feel tired.
Yeah.
And can you describe the tiredness? Is it different to normal tiredness, or is it like normal tiredness?
So it's really hard to explain. I don't think I can explain it.
Now, I'll maybe just explain what I've heard from other people, is that they feel like it's like the most exhausted they've ever felt in their life.
Yeah.
Or like if people have ever done races or like done really strenuous things, it's like you've just run a marathon.
Yeah.
You describe this elephant sitting on your legs thing.
Yeah.
So it's just an utter exhaustion.
Yeah.
And you mentioned you couldn't even lift your phone at times. Yeah. So some people can't open their eyelids or speak. And so it can be very distressing.
Yeah.
What's exciting is that I've heard that you are actually making little improvements.
Yeah.
Can you tell me a bit about those improvements? Because we're always looking for hope in this really challenging environment.
So when you gave me tablets, it was what was it?
The blood thinners and the statin,
yeah.
I think.
So they helped me with my dizziness. So before, when I tried to stand up, I was really dizzy and I couldn't move. But now, when I took those tablets, I can now stand without being dizzy and I can do a few steps.
That's awesome.
Yeah.
Well, I really hope those sort of progress continues. Jay, if there was anything that you could tell other people, teenagers with long COVID, about how to cope with it, what would you give as advice?
I say take it day by day, because you will get better eventually, but it will just take a while.
That's a great attitude to have, and I think the day by day thing is brilliant. Deal with each day as it goes. And Neera, I'm sorry, I've been talking a lot to Jay, but
okay,
do you have any advice as a mum, as a doctor, parent, as a doctor?
As a doctor, I'd say definitely health professionals need to listen to patients and document their symptoms. And as health professionals, we always like to put things in boxes, but with long COVID, it seems there's multiple symptoms and each patient's different. And you need to look at people as a whole person and treat all the problems they present with. As a parent, I'd say to other parents, if you're worried about your child, keep pushing, keep going to the GP, keep looking online. The Long COVID Kids Charity is amazing and so supportive, and will help with any questions you have.
That's awesome. And we are producing little, very short videos. You mentioned the energy bucket, so Dr. Finley's got this little TikTok and YouTube and Facebook channel, and we're basically, producing little videos on how to survive, how to manage your energy, that kind of thing as well. Yeah. So, but there's lots of resources now out there. Yeah. It's so good to see how you guys have worked together on this journey, and it's been amazing talking to you today. We've run out of time. I want to say thank you so much for coming in, and it's been a real pleasure to speak to you today, and I look forward to watching your progress. And would you be able to come back and talk to us maybe in a year's time, see how you're getting on? That'd be really fantastic. Okay, thank you so much. I'm going to shake you by the hand. Have a safe journey home.
Thank you.
Jay, thank you so much for bringing your lovely artwork and your experience. That's all we've got time for today on Health versus Wealth with Dr. Ben. So I look forward to seeing you on our next episodes. So that's it for today. I hope my guest and I have helped you meet some of your health versus wealth challenges. Now, to hear more from me, Dr. Ben, why not subscribe on your usual podcast platform? And if you like my advice or you'd like to be a guest on the show, you can email me on podcast@drfinlays.co.uk. Anyway, I hope to see you again, but for now, it's goodbye from me, Dr. Ben.